Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, everyone. Welcome back to the Lionhearted Dental Podcast. I'm Dr. Steve Rasner, your host. And last week, I deliberately changed the direction of the podcast going forward because I want it to be something that I just don't tell you what you should be doing, but exactly how to do it. If you're going to watch me weekly or once a month or whenever, I want you to be able to take from that specifics so you can take it back to your office and know how to do it. So, as you know, last week we spoke about my favorite subject in the world for your dental practice, and that is oral sedation. And I'm hoping that the takeaway from that podcast for you was, number one, how impactful that one skill set is in so many arenas, because it allows you to market. It's not something you have to train at for years to become good at. And it actually is a service that you would provide more than anything else that will snowball your word of mouth referrals. Gosh, and it's easy to get. I don't think a 60-hour CE requirement is a overwhelming requirement for you to fit into your schedule. So that's the takeaway there. I don't remember receiving too many follow-up emails on that subject, which is, maybe it's because I talk about it so much over the last 3 years. But this week, I'm going to speak about 5 minutes in your 8-hour day that can determine your entire career path. So I want to say that again. I'm going to talk about 5 minutes that happen each week in your schedule that can absolutely determine your entire career. Is that overstated? I think not. So the 5 minutes I'm speaking about are those first 5 minutes when you walk into the room with a new patient. Don't turn me off. I want you to think about it. I know I've talked copiously in the last 3 years about what I spoke of last week, oral sedation. And now I'm telling you about certainly a branch of case presentation, the first 5 minutes of that moment when you're in a room. Because to me, that's how powerful those 5 minutes are. Because determining the path of your career, well, are you happy? Those of you right now in private practice, those of you working for an associate, do you think your career would be more interesting, more profitable, more fulfilling if you worked on treatment plans as opposed to one-tooth dentistry? So I think the answer to that is pretty obvious. And that's why I call it a career determining 5 minutes, because it really does happen in the 5 minutes. And as I stated to you in the beginning of this, I want to give you the how-to. How do you maximize those first 5 minutes? And remember, I'm not talking right now today the how to set up those 5 minutes, because we've spoken abundantly about that issue, right? We've talked about your branding. We've talked about what it should look and feel like when that new patient, because of your branding or because of word of mouth, finally picks up the phone for that first time to call Dr. whoever you are, right? What does that feel like? Is that a random event? I can tell you after 41 years If I happen to be at my private office with the door open, and my office is right across from the reception front desk area of my office, and I hear what I feel sounds like a new patient phone call, I'm listening intently because it's such a big moment, even that moment is, that gets me to the moment I'm going to talk to you about. It does set you up completely. So why is it that those first 5 minutes are so important? The first 5 minutes, what I'm talking about right now is the table's been set for you, right? You've done some of the marketing I've recommended. You've branded trust and confidence like I so push you to do. And please, reach for me if you don't know what I'm talking about. If this is your first time, maybe you don't feel like going through the old podcast and going back to what I'm talking about when I talk about branding trust and confidence. How do you do that? I've covered that a lot in the past. And you've done that for this moment, let's say. Let's assume that. And they've gotten through that initial call, and today's the day of the appointment, and they've done the beginning of that visit, and now you're walking into the room. So what exactly would I coach you to do if I was in your office, if you allowed me to do that? The first thing I would tell you is to be extremely on time. You want to kill a new relationship? Make them wait more than 10 minutes. That is completely the maximum. And the way you get around that is by knowing in the morning meeting that there is a new patient scheduled today at 10 o'clock or whatever time it is. You have to be cognizant of that. And I want to tell you, it gets a little bit complicated if you're running your practice and doing surgical procedures abundantly like I do. And so the timing is not just your front desk new patient coordinator has to be able to look at the schedule and look at the left and the right of what, if you're working more than one room, are you really able in this segment of time to break from what you're doing? Or is it a clean 45 minutes for you to walk in and introduce yourself? Okay, so really I have to say that to you. I didn't plan on that. But you need to sit down. Remember I told you I'm going to tell you exactly how to do this. So you have to have a meeting with your person that's scheduling your new patients. This needs to be an event because so much is on the line. If you're constantly getting patients, or more often than you think you should, saying, leaving without a commitment, and they need to think about it, or you're not feeling a connection, maybe you need to relook at these moments because maybe you're losing them early on. Maybe it's not a big deal for you to be on time. And when I say be on time, that patient's had to have some things done. If they arrived in your office at 10 o'clock, they are probably ready for me at 10:30, quite honestly. And in that 30 minutes, they've gone over their proverbial paperwork. They've had a new visit conversation. I said a new visit, meaning Michelle's already had a conversation with them over the telephone. And now she's come in face to face. You don't think that makes a difference? Of course it does. And as you know, I'm such an advocate of the spouse coming with this new patient if they've indicated any type of need. So to be lucid, abundantly clear here, if they've said, oh my God, I've wanted to come to you for years and I'm finally making the move, you're going to love my mouth. I go to the dentist every 4 months. No, I probably wouldn't, ask that the spouse come to that visit, the significant other. But I get just most of our calls are somebody disgruntled about a prior experience and we always encourage, under those circumstances, their significant other to come with them. So remember, now they're in your office. So Michelle's having this brief 5-minute conversation, sometimes longer, by the way, hopefully in a place in your office where there can be a door closed, so there can be complete autonomy and intimacy in terms of no one listening in except your new patient coordinator and the husband and the wife, or whatever the relationship is. And I get coached on that before I walk in that room. And look, honestly, most of the time it's not like mind-boggling findings but sometimes Michelle, and I never skip this, by the way, and you need to never skip this re-interview. And the way that happens is she says, hey, I know we spoke over the phone, Mrs. Green, but let me make sure I have all the information Dr. Rasner's going to want to know, and we want to know before he proceeds with his exam. And sometimes she will tell me, the husband's very doting. This is a really nice person. They worked for 35 years. They just took care of their mother who had dementia for 7 years, kind of let themselves go. Their kids just went to college. Sometimes the opposite. Their budget's tight, but they know they have to do something. Anything she can give me makes it a little easier for me when I walk into the room. Doc, this is the most scared patient I've seen you that I've brought in for a visit in the last, I don't even remember when. The husband is hard to read. It looks like he's not happy to be here. You get me? I'm hearing all this, okay? And then I'm aware that if this appointment started at 10, that about 10:30, not at 11, when I get over there, this patient doesn't want to hear that I'm tied up in a surgery. And has that ever happened in my 41 years? Absolutely, but not often. Because I know that one way to ruin a new relationship is to make somebody wait for you. So I have factored that in. You need, if you don't find that you're on time, you need to factor that in. And it's not a coincidence I'm making a big deal about you being on time, because it can undermine everything else. Okay. I have deliberately, and I'm not kidding about this, stepped in my private bathroom, brushed my teeth, make sure I have fresh breath, look crisp, don't have some vinyl polysiloxane material on my collar, or a salad, piece of lettuce from lunch. I'm serious. I want to look as fresh as I can. The rest for me, and I hope for many of you, is easy, because it's easy for me to be excited and engaged about meeting a new patient. It is. I am excited about it. So I don't have to fake that. And so everything else is in place. Here's those 5 minutes. I walk in, I look them directly in the eye, and that's hard for some of us, right? I'm not even talking right now, to make this clear, about the whole case presentation process. I'm talking about the first 5 minutes. And I sit down, I look at them in the eye, and I usually say, so how did you find us? Welcome to the practice, by the way. How did you find me? And the answer's all over the map. It's hopefully, which I don't know how it could be, I was on their assurance list, because I'm a fee-for-service practice. But sometimes I do hear that. And that's about as big a turnoff as they could possibly say to me. I'm here because you're on my insurance list. And if you weren't, I wouldn't be here. They don't say that, by the way. So I said, well, welcome. Let me say to you something I always like to tell a new patient. This is what I'm saying to them. And I know it's weird to meet somebody new and then talk about yourself, but I'm really not talking about me. I'm talking about where you ended up today, because there's 50 other dentists you could have gone to in a 1 hour radius, and you're in my office. And I want to tell you what that's about, and I'm pretty sure you're going to love it. You hear me? I said, you could have been in a lot of other offices today, but you ended up with us, and we're thrilled about that. And I want to tell you what we are about, what we believe in, and I'm pretty sure you're going to love it. That's what I say. That's not a bad thing. And I have, by the way, a lot of this in a blog that Beth would gladly send you. The first 2 minutes is what it's called. The first 2 minutes. So I'm looking fresh, I hope. I don't look like I just woke up and got out of bed. God forbid, I feel like I don't have fresh breath, and I know that we wear masks and all those things, but I'm fresh. And I want to say one other thing right there. Let me stop and just take a side. Why is this such a difficult and important moment? Well, number one, 3 reasons. I think a lot of the public is capricious. They're fickle, and they almost are. I always go back to that. Those of you who are not familiar, Google the Reader's Digest study of 25 years ago. I didn't do this, but I'm pretty sure it'll come up. And what happened is the Reader's Digest sent out an editor to 10 dental offices. I think it was done in Canada. And they got a range of treatment plans from nothing to $30,000. Same patient, same editor, 10 different offices. And it was a big story in the public eyes that I don't think ever went away, personally. I think that some patients, many patients, think or have a distrust problem with the dental profession. And it's for even those of you that are stone cold honest, even more with you, because you're going to recommend more because you're a thorough dentist. That is why this is such a delicate moment, okay? Number 2, it's an industry. These are the 3 reasons this is so important. We're in an industry, you and I, that doesn't take itself seriously. A lot of our colleagues are fine with drill it, fill them, and bill them. What does my insurance take? Because that's how dental medicine works, right? Pathology works according to insurance. So the people's mouth know not to develop dental problems that would exceed a person's yearly insurance. So a lot of your colleagues function that way. And hence, when you don't, which I don't advocate that, obviously, you've heard me endlessly talk about a comprehensive care approach. I don't know how you could address it any other way. So that's the second reason it's difficult. And the third reason is, think about this. You and I chose a specialty where much of the pathology is asymptomatic. So the patient in your chair, no matter what their educational level is, their socioeconomic status, wealthy or not, are often completely unaware that they have bone loss, a periapical abscess. Come on, am I telling something you don't know? So a public that's already a little bit distrusting at times about dentistry, that even 20 some years ago enlisted a study to prove that. An industry that many of us don't approach our patients' entire oral health. At least they have the right to know, don't they? Whether they treat it or not. And thirdly, that what we treat or recommend to treat often is something unaware to a patient. Hence, when I have the ability, and I don't know how to teach this other than practice, for when I sit and I'm looking at the x-rays, by the way, I should have said that. They've already been taken. So listen, I don't know if that develops that skill set develops at year 1, year 2, 5, or 10. But trust me, it does develop. That you can look at x-rays and in nanoseconds start to see a picture here, correct? Do you not? So let me give you an example of that. If you have a patient in your chair that has really minimal dentistry in their mouth, they have all their teeth, they've never had root canals, crowns, they have a couple small restorations, and you examine them and see small interproximal caries that you're not sure if it's through the enamel, I'm never recommending they treat that at the first visit. That mouth will tell you a story. And the mouth of the person I just described to you is telling me that they're pretty resistant to dental disease. So to me, the worst thing I could do is use dental school year 1 or 2 parameters as to, oh, this cavity needs to be restored on a patient whose mouth seems very resistant to, and I'll tell them that. I excitedly tell them, because I can't give you guys a script, one script, because every patient, there's many scripts that I'll go off on from the patient that's in front of me. So I would be very conservative with a patient who has a minimal dental history for a lot of reasons. Number one, I think I should be. Number two, I don't want to be the story that this patient tells to the next dentist that, wow, I've gone to a dentist, I had to switch because we moved here, but I've gone every 6 months my whole life, and Dr. Rasner told me I had 9 cavities. Well, maybe they did have 9 cavities, but maybe none of them, in my opinion, were actually through the enamel into the dentin. And that's a patient I'm going to be ultra conservative. That said, what about the patient that also says, I've been at the dentist every 6 months my whole life, and they didn't know that they were going to good old Dr. Joe? And I will bring up the name. When I see a patient in my chair, okay, this is the patient. They're there because they broke a tooth, okay? They're there with their spouse. They're good people. They work. They're not blaming anybody. They kind of are happy that they went to the doctor they went to for 25 years who retired last year. This is a common story right now in dentistry the last 5 years. So these patients went to a long-time dentist and did not like the next dentist because the next dentist was actually being a dentist and not just their friend. And I call that first dentist good old Dr. Joe. And I tell so if I have a patient in my chair, this is the part that's hard to teach. And I've done my early exchanges with them about, which I didn't finish, I want to get back to that, where I'm telling them, how did you find us? Let me tell you about our practice. So let me come back to good old Dr. Joe in a second and tell you, finish that. And I'll say, what do you do? And they'll say, whatever, let's say they say they're a teacher or a nurse. And I'll say, the reason I ask you that is because whether you're a teacher, a nurse, a cop, a lawyer, a dentist, we're not all in at the same level, right? I mean, you could be in a profession for years and like it. Maybe you don't love it, but you like it. And that's your life. And you have other things that you're much more passionate about. And everybody gets that story. I hope you guys use this, by the way, because it's so effective. And it's true, which makes it effective. I said, well, I'm not that guy. I'm the guy that was lucky enough to love what he chose to do. And people will say, when you say that, they'll interrupt you and say, don't they say if you love what you do, you never work a day in your life? People get this. Do you hear what I'm doing with you right now? I am telling you how those first 5 minutes flow. I am trying to teach you or make you better at connecting with somebody that you didn't know the day before. It's not an easy skill. And what I've told you is eye contact. I've told you to use I didn't say this, but a voice with passion. You're not a monotone. Hi, I'm Dr. Rasner. I'll be examining you today. Please open. I hope nobody does anything close to that, but I think some of you might. And what I'm trying not to do is I'm trying to not turn this person off. I'm trying to turn them on to, because I'm about to do a comprehensive exam, which likely costs more. So that's not going to go well with somebody that those first 5 minutes aren't going well. By the way, I make sure you say acknowledge the staff. The significant other that's in a chair. I used to put them, by the way, in my dental assisting chair. But 5 years ago, I went out and I bought real comfortable chairs with wheels for all my operatories. And, my operatories aren't 20 feet by 20 feet. We somehow have them in the corner. My operatories are 12 by 10. So they're big enough to make this happen. Because I was always worried about the patient falling out of the dental assisting chair. So back to trying to tell them about what kind of practice they're in, I'll say, I am the person that was fortunate to love what he did. And when you love and I remember wanting to be, I actually said this, the best dentist in the world. And 40 years later, I know that may not even be a thing, but I didn't know that when I was 25. So all I did was train to be as good as I could possibly be. And I went all over this country and found the best dentist at root canal and the best dentist at gum health and on and on and on. You don't have to even really be specific. I said it along. The best at recreating smiles. And it's really what I did with my adult life. I can say, I've never really even golfed before. Or do I have a boat? This is what I did. Now, how you want to spin that talk is up to you, but they kind of get it that I'm into it. And I said, so depending on what I'm seeing as I'm speaking to this patient, because, at the same time, I'm looking 12 inches to the right, and there's a computer screen in front of them that has their x-rays taken on it. It doesn't take long to kind of get a measure of what's going on, right? If it's awful, it certainly doesn't take long. And so if I'm looking at somebody who I think doesn't know they have a lot of pathology, I will bring up Dr. Joe. And I will say, there's two kinds of doctors in my profession, in my opinion. One of them is called good old Dr. Joe. And Dr. Joe, you love. And as soon as I say that, they get it. You know why you love him? Because he always tells you, we're going to watch that. We'll keep an eye on that. If you don't do this a little better, we're going to have to consider a different. And you love Joe because he never recommends anything, so you never have to spend any money or time in his chair. And he's probably has $1 million personality in 30 seconds. You probably attend the same civic club or social events. I get it. But the problem is that Joe retires and you have a mouthful of pathology that you didn't know about. And that's because in my profession, a lot of things, this is what I'm saying to the patient, a lot of things can be wrong and don't hurt. And sometimes I'll say at that moment, if you had a fever today, you don't need me to tell you have a fever. You don't need a doctor to tell you that. If I was a dermatologist, do you need me to tell you have a big rash on your arm and where did that come from? Of course, you see that, but not in dentistry. So it becomes a greater responsibility for me, for us, to be thorough with you. And that's why I take the approach I take. Guys, everything I've just told you is as sincere, honest, and true as it gets. And this is what's it took me 30 minutes to tell you this today, but this is what's going on in those 5 minutes. And I don't know what I'm walking into until I get there. And sometimes, by the way, I'll take it a step further. I'm going to finish with this. I'll actually begin my exam. So prior to now, I've just looked at their x-rays, spoken to them. And now, by the way, I also say, when I look at you, I'm not going to be poking you. Look, I get a lot of patients because of oral sedation who are terrified that I'm going to take out a periodontal probe and sink into their bone. So I deliberately say, no, I'm not poking you. I have 5.5 magnifications. I'll be able to examine you and direct us based on what I'm visually seeing. And if I put them back and I start to see, wow, this is really a complicated mouth. I didn't recognize from the x-rays that their occlusal schemes were off as bad as they were off. And there's a lot, they have a collapsed vertical dimension. You can't see that on an x-ray. I started to say, I will stop the exam. I will sit them up. This is probably worthy of its own podcast. I guess I could call it What to Do When You Recognize You Have Complex Cases. Because you can't always see that in a few minutes. And I will sit them back up and I will get in deeper, because I don't want to talk to them when they're reclined. And I will say, listen, tell me where you're really at with your aspirations for good oral health. And most people will say something like, that's not very helpful. Like, I want to keep my teeth if I can. That's what they'll say. Well, we all know if you can is a loaded conversation, because that means how much you're willing to invest and how many are you really on board with this. And I can end it with a story. I had a woman come to me last week who had been to the dentist regularly. It was just like I just discussed. And she would fall under the category, what I would call watchful neglect. By the way, she was under the care in her life of an orthodontist and a periodontist who kind of watched her into losing teeth, because she surely was going to lose some anterior teeth. Now, I'm not privy to, maybe she wasn't telling me and declined treatments, but when I asked her the question, did anybody ever discuss with you in depth the concept of losing bone and what the consequences are of that? And this was a patient that was under the care of a specialist and lost faith. And from what I saw, kind of rightfully so. I don't have all the facts. I just have I don't have his side of the story. She wasn't mad either, but she was definitely losing teeth. And, I was wondering when I was in those discussions, I don't want to trash my colleague. I don't want to incite this patient. That doesn't help anything. So I had to put her up when I realized she was going to lose teeth in the interior, by the way, of her lower. And I said, listen, I am meeting you for the first time today, and I'm seeing things that, according to me, are going to require significant investment by you of time and faith in me, because I believe you're going to lose some of your front teeth. And we have to talk about replacement. Every story is its own story, correct? Doesn't sound very bright, but, I didn't want to throw anybody under the bus, and I didn't. I think I saved us all. But that turned out to be a huge treatment plan on somebody that had gone fairly regularly to the dentist. I wouldn't call him a good old Dr. Joe, or maybe he was. I guess the good old Dr. Joe could be a specialist as well. I'm not sure. I actually usually find periodontists incredibly thorough and meticulous in everything, including their diagnosis. So getting off the point here, that what I wanted to say to you is this all comes back to those first 5 minutes that you can ruin. You could have the greatest diagnostic skills in the world and the best hands, but you're not going to get to use them if you don't engage and connect with not just one patient, but the significant other in those first 5 minutes. Ma'am, I hope this is helping, this approach. We have a lot to talk about to improve your practice, and I'd love to hear from you. So I'll see you next week on The Lion-Hearted Dentist. Thanks for joining me.